Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in adult transgender care. Welcome to my channel. If you're new or a regular viewer that has not yet subscribed, I would very much appreciate if you do. This is the best way you can show your support for the content that I make, so please do. And for all of those of you who already are subscribers, I very, very much appreciate your support. For today's video, I want to share with you my professional opinion over the years of working with transgender adults, whether low dose or monotherapy of feminizing hormones can actually be helpful. This is a question that I get asked a lot. A lot of people wonder if going on even a low dose of feminizing hormones is going to make any difference at all. And for starters, let's put it this way. A lot of you, well, all of you ideally know that I'm not a medical doctor. So this is definitely something you want to have as a discussion with your medical provider in terms of what are your goals are and what are you trying to achieve. I will share as a psychologist who is worked and continues to work with a lot of transgender women. In my experience, low dose of feminizing hormones does definitely makes a difference. And I want to share with you my observation on what specifically, in what regards it makes a difference and um, what type of individualistic goals it tends to help with. So a lot of times when people think about low dose feminizing hormones, people are not really thinking about necessarily getting a lot of physical changes, right? Usually, in my experience, clients that I work with who are considering a low dose of hormones are individuals who are not really yet ready to step into any kind of physical changes in regards to their bodies. They may also not want any kind of physical changes that might be noticeable to anybody else. They may also not want to have so much estrogen in their bodies that it may inhibit or affect their sex drive or their ability to be able to maintain and sustain an erection. For that reason, they also don't even take any testosterone blockers, but only low dose of feminizing hormones. And sometimes people wonder, well, what is the point? What would be the point then to even go on low dose feminizing hormones? Well, one of the biggest benefits as a psychologist that I have seen is for individuals who I work with who do have severe or pretty moderate gender dysphoria to the point where they're really psychologically in distress. It occupies a huge portion of their headspace. They have a hard time focusing on other things in their lives. They have a hard time concentrating. In other words, the gender dysphoria is so forefront and predominant in their psychological headspace that it makes it very, very difficult to carry on from day to day. And so for individuals with that much distress, low dose of feminizing therapy can definitely take the dysphoria a notch down, can take it down to the point where they now can start focusing on other parts of their life. Now, for some individuals, it doesn't work. The low dose doesn't really do anything. And sometimes people don't know until they work with a medical provider and they give it a trial and they see whether low dose feminizing hormones has any effect on them at all. Usually, people will have a low dose of feminizing hormones in the form of patches or in the form of oral administration via pill. So, another thing about low dose feminizing hormones, and the reason why people tend to go on it, is because when dysphoria is so forefront in one's life, in one's headspace, not only does it interfere with one's ability to just focus, to just do other things in life, but it also can make it very difficult for an individual to quiet their mind to start figuring out what they really want to do about their gender dysphoria to begin with. And a lot of times going on a low dose feminizing hormones for people helps achieve that. It helps to quiet it down to the point where now they can really, from a more quieter headspace, look at their situation and then figure out what is the best course of action for them. That is another reason why feminizing people go on feminizing low hormones. Um, Another reason for low dose of feminizing hormones is for individuals who, just in general, not only have strong gender dysphoria, but also want to experience whether feminizing hormones are right for them. And again, it comes into discussion with the provider whether it's a good fit for you and what are your goals are and what are your overall, things that you're trying to achieve. But these are some of the primary reasons why people go on feminizing low dose hormones. And another one very important reason is when individuals come to me and they say, I have a lot of dysphoria, it really interferes, I have a hard time continuing day to day, but I don't think transition is going to be worth it for me, or I don't want to step into gender transition for personal numerous reasons and circumstances. And so low dose hormone therapy becomes something as an option of medical treatment that is, if it helps, if it especially quiets gender dysphoria, it helps individual to cope, to continue to alleviate the distress so they can continue moving forward in their life without stepping into any other gender transition services, because that at that point is not for them. But low dose of feminizing hormone therapy can and undoubtedly does definitely work, and it's not a placebo effect, because I have observed it many times again and again and again. One of the ways I know it's not a placebo effect is because I had clients who do wonder, is this placebo effect? And so, because they're so concerned that it might be placebo, they stop taking it and then they resume taking it. And when they stop taking it, they experience the resurfacing of gender dysphoria. And then when they start taking it again, they experience dysphoria quieting down. And that's how a lot of my clients, by just trying it out themselves, stopping and starting again, know that it's not a placebo they're experiencing, it really does work. Again, hormones in general, as I always say, work for everybody differently. And everybody has to figure out what works best for them in a very detailed and close dialogue with their medical doctor, because everybody's body metabolizes hormones differently. Everybody's bodies respond to hormones differently. I had clients who are on a very low dose of feminizing hormones and they're already getting breast growth. I have clients who are on a regular dose of feminizing hormones and they're not having any physical changes. It just shows you just don't ever know. But definitely low dose of feminizing therapy can help with gender dysphoria psychologically, can quiet it down, can really take that edge, that nudge down, that feeling of tension, that feeling of angst inside the head, that feeling of white noise, like I always say, in the back of your head space. It really takes that, for some people, it even takes an element of gender anxiety down. Is the solution for all people? Of course not. But it definitely helps a lot of people who are struggling with gender dysphoria and want to step into a low type of medical treatment without going into full-blown, I would say, regular regimen of medical hormones. Definitely, in my experience, I have seen people where it does help. And remember, there's some people for whom it doesn't help. I know there's a lot of sometimes, not sometimes, but on the internet, we hear a lot of discussions, right? Where people say, don't even waste your time with low doses, go on a full regular dose. You know what? You really have to talk to your doctor and discuss what your goals are. People who say low dose doesn't work at all may have completely different goals. They may be alluding to experiencing physical changes, which are a lot of times, much more likely on a regular dose of feminizing hormones. So, but if you are wondering about stepping into, and if you feel like you're at a point where dysphoria is really interfering with your life, and you may not be ready to do other things. You may not be ready to social transition, and you may not even want to ever socially transition, and you may not ever want to go through transition at all. But you feel like you've tried a lot of other things, and you wonder whether low dose of feminizing hormones might help with gender dysphoria. It's, in my opinion, I have seen it work, and it's definitely worth a discussion to have with your medical provider and see whether you would be a good candidate for it and to discuss whether that actually will meet your goals. Comment below if you tried low dose of feminizing hormones, whether that worked for you, whether it helped you take a gender dysphoria down a notch. Comment below, share, and I'll see you guys all next time. Goodbye.